information later if you need it, but for now, I would just like to hear from people about kind of the programs they're doing. And if you don't mind, I'd like to have you talk about your program.
Well, thank you again, Barbara, for inviting me. I've learned about your networking on the newspaper. So as far as it was just a little one, but it caught my attention. So as far as that's concerned, that's just wanted to learn more. I know that we've been working with the Navajo Nation as a nonprofit organization for the last 4 years. We got a grant from CDC, Center for Disease Control, doing tobacco control on the Navajo Nation. So
microphone's open.
Oh, right, excellent. I'm sorry, we'll continue.
You got cut off, Dave.
Out of the hot seat. Well, welcome, Dr. Lopez. This was quite a challenge.
I was thinking about working today.
Thank you so much for inviting me.
Great. Could you talk with us about you and your program, please?
Sure. Hi. My name is Ana Maria Lopez, and I see Peter Lance, so certainly there's representation from the Arizona Cancer Center. And I'm coming with you also to represent the Arizona Telemedicine program, which I believe, did you receive the packet with the maps?
Yes, we have the material here. Thank you.
Great. So,
could we please turn off the remote mic? You'll have much better audio, and then turn it on when you have a question. That'd be great. Thank you.
That's our handy-dandy technical person, Janet Major. So you can see on the map the sites that are connected through telemedicine. And I can share a little bit about telemedicine, but I'd love to have your questions as well. But through the network, we can provide both clinical as well as educational programming that can come from Tucson, can come from Phoenix, can go between sites. So for example, Hopi and Flagstaff do post-operative care together. We have a very strong cardiology program. We have a very strong program in pediatric neonatology, radiology, pathology. So really the possibility for applications, it's very, very broad. We do fetal ultrasounds, we could do tele-oncology, we've done tumor boards. So there's really a lot of possibility, which I think is one of the great aspects of my position, is to really work with communities and together come up with what would really seem to be the applications that would work best for you. And in some aspects, it may be a combination. So for example, we are doing some HIV clinics, and where we do a blend of teleradiology as well as the in-person infectious disease consultation. So there can be blended aspects to the clinics as well. But a lot of possibilities, and I'd love to hear how any of this may be of help to you and to facilitate. I think we're all together because this is a very important clinical topic, and really appreciate Barb and all of the folks there for the invitation and the coordination. Thank you.
I'd like to hear from some people here in Fort Defiance and Defiance and so on. Are you currently involved with the telemedicine program? Okay, well, maybe Deborah, you can just introduce yourself, because again, you can see where there might be ways we can connect.
Hello, my name is Deborah Corman. I'm from Cancer Service Unit. I'm the RN Discharge Planner, Utilization Review Nurse, and Patient Liaison.
Deborah, you're at Fort Defiance?
No, I'm in Cancer Service Unit in Cancer, Arizona.
Kayenta. I'm sorry, I missed that. And one of the things that maybe would be a topic for a separate meeting, but You know, several of the sites, of the IHS sites, have connectivity. And there's, you know, folks have come for training at different times. There's several of the chapter houses are connected. You know, if there's anyone there who'd like to share some of those experiences, I'd be most interested to see how it's working for you.
I think, Anna, my name is Michelle Morgan Flowers. I'm the utilization discharge planner for the hospital. Our physicians are busy in the clinics today, so kind of Friday is their busy day. We are using the telemedicine here at the hospital with colonoscopies, and they are looking at some of the more home-based care, doing some of the telemedicine also. So I think we're still like probably in the talking phases of a lot of the phases here at the hospital and developments of what we can do. We did groundbreak 2 weeks ago for a new skilled facility, which will be 120 beds or something? About 120 bed new facility, which will be going up. So I think there's a lot of possibilities in community services that we're going to be looking at. And I know the mammogram, they're doing the mobile units also for the mammograms and bringing those in. So I think there's a lot of technologies that are going to be opened up working with you guys in the future.
Well, we'd love to help you. We have put together several programs in telemammography as well as telepathology and same-day biopsy services, which may be of interest to you. And certainly the skilled nursing facility, home health services, hospice services, where we use different types of technologies that I think are very user-friendly for the home-based situation. Some are phone, through phone lines, some are through wireless systems, and really trying to best understand what modality is most appropriate for the home. You may have searched some of these systems already, but some of the systems have monitoring attachments, so you can monitor electrocardiograms, you can have heart sounds, and some are very simple that are really just being able to see the patient and talk with the patient, really a miniature form of what we're doing right now. So lots of possibilities, and you know, we'd love to be able to demonstrate, bring options to you, see what would work for you, maybe work together to develop some of this with you.
I'm hearing so many possibilities, and I think this is really wonderful. And what I hope we can do as a result of this kind of initial meeting is have you, with your incredibly busy schedule, take a look at some dates over the next couple of months where maybe we could have another meeting such as this that doesn't have to be part of a conference, and possibly on a different day of the week, where we could have people kind of at different places. For example, I don't know, Bertha, you may know, do you know any of the chapter houses that have this connection?
I missed the very last part of what was said.
Where there were chapter houses that do have the connections or the potential, because that's something we've wondered about, you know, how we could do that. So where would they be